with the patient population that we were working with, who are largely poor, underserved, Spanish speaking, with varying levels of education, that we very quickly realized that we needed to do a lot more than just provide healthcare services within the confines of our twice monthly clinic sessions, and that in order to really effectively treat our patient population, we also had to provide our patients and the greater community with education and outreach and initiatives that would help to improve health literacy and also access to information within the community. 4 years ago in March, SB Home held its first annual health fair at the Central Islip Recreation Center, and in our eyes this was a way to do two things. First, we invited a lot of community groups. About 20 attended that first health fair, and these groups set up tables and provided information to all of the people that were attending the health fair. And really, it was a great gathering of community resources for our patients and for the greater Central Islip and Brentwood communities. And then second of all, we also provided a lot of point of care screening tests for a lot of different diseases and disorders, including blood pressure and glucose, cholesterol, depression, HIV. We've added peak flow, glaucoma, and this was a really great way to provide these screening tests to our patients and also to the community. And then at the end of the day, people could show their screening test results to a doctor or a fourth-year medical student and make follow-up appointments at an SB Home clinic session. So we weren't just saying, hey, you have hypertension, have a nice day. We were saying, hey, you have hypertension, come to us and you can get our health care from us. So it really provided this nice continuity of care for the patients and for new patients as well. The health fair, even beyond that, was a great way for the Stony Brook community and the greater Stony Brook Health Sciences Center community to really come together. So we had physicians from the Stony Brook Department of Ophthalmology, people from the Stony Brook Medical School, the Stony Brook Dental School, the Stony Brook PA program, and this year we're having students also from the Stony Brook Nursing program coming together to provide all of these screening tests to the Central Islip community. And in that way, it really became this great interdisciplinary day where everybody could really learn from each other. It's really gratifying to reach out to community members and community organizations and have them thank you, a medical student and somebody from another community, and tell you that you're really doing something that serves Central Islip and Brentwood and populations there that wouldn't have anywhere else to go. And for them to tell you that we want to refer patients to Stony Brook Home. We think that you're doing good work, and we send patients to you and you speak to them in Spanish, you give them materials in their language, you make sure that they have follow-up and lab tests, and we really respect the work that you're doing.